So as you prepare to call your patient, you may be asking yourself, why did the American College of Obstetrics and Gynecology recommend screening for cystic fibrosis in all couples in whom one or both partners are Caucasian? They also recommend that you make screening available to all couples regardless of ethnicity. Well, this is a complex question and requires knowing something about CF. First, CF is the most frequent serious, and by that we mean fatal, inherited disease in the United States. It affects 4,000 children a year, of whom 6 are born in a small state like Maine, and 50 in a state with the population size of Michigan. Disease-causing mutations are carried by approximately 1 in 25 men and women of Northern European Caucasian descent, and less, but still a substantial portion of individuals of Hispanic and African American descent. Finally, the gene associated with CF has been well characterized and allows a cost-effective way to do carrier screening. Francis Collins, who is now the director of the National Institutes of Health, or NIH, started on his very successful scientific career by helping discover the gene associated with CF while at the University of Michigan in 1989. The CFTR gene is on chromosome 7, as shown on this slide. The mutation that led him to discover and then clone the CFTR gene is called del F508, which means there is a deletion, del, of the 508th amino acid of phenylalanine, or F for short. This mutation is found in 70% of people with CF. Once the gene was recognized and its sequence of DNA bases established, it became possible to look at the other mutations in the CFTR gene in people with CF. It turns out that there are over 900 mutations that can cause CF if both copies of chromosome 7 have one of these mutations. This has led to the ability to do preconceptual or prenatal carrier screening. Interestingly, and this is what makes the feasibility of screening unable to detect all mutations, all but 4 mutations are found in 1% or less of CF cases. So that is why we are only able to detect 80% of couples with a high 1 in 4 chance of having a baby affected by CF. So why, if screening is not able to detect all at-risk couples, is screening offered? It has to do with the serious nature of this disease. Because the CFTR protein regulates the salt content of the body's secretions, and its malfunction increases the thickness of these secretions, CF involves respiratory, GI, and pancreatic dysfunction. A good source of clinical information about CF can be found in gene reviews at the National Library of Medicine. Typical respiratory manifestations of CF include a persistent productive cough, hyperinflation of the lungs on chest X-ray, and pulmonary function tests that are consistent with obstructive airway disease. As the disease progresses, chronic bronchitis with or without bronchiectasis develops, and is accompanied by acute exacerbations characterized by increased cough, tachypnea, dyspnea, and increased sputum production. Colonization of the airway with pathogenic bacteria occurs early in life. Staph aureus and Haemophilus influenzae are common pathogens early in childhood, but Pseudomonas is ultimately isolated from the respiratory secretions of most patients, with greater than 80% of adults having Pseudomonas. The majority of patients also develop sinus disease. Insufficiency of the exocrine pancreas is also present from birth in most patients with CF. This can lead to failure to thrive in infants. The life expectancy for individuals with CF has been steadily increasing, as shown. The median survival is predicted to be 37.5 years for individuals born in 2008. However, it is of note that 4%, that is 1 in 25, die before age 15. This is in contrast to the overall death rate for 15-year-olds of 1 in 2,500. So, as preparation to making a call to your patient to request her partner's sample in order to complete the screening, you should now have some idea why CF is considered a serious condition.
Check your understanding by answering the following questions. After listening to each question, pause the video and select your answer. Then listen to see if you are correct. The delta F508 mutation is found in greater than 70% of all chromosomes in patients with CF. True or false? The correct answer is true. What is the projected median life expectancy for a CF individual born in 2008? about 65, about 55, about 15, about 37. The correct answer is D. What is the function of the CFTR protein? It is a pancreatic enzyme. It regulates salt content of the body's secretions. It promotes cell division. It regulates lung function. The correct answer is B. What difficult to eradicate bacteria is found in sputum of 80% of adults with CF? Citrobacter diversus, Haemophilus influenzae, Streptococcus pneumoniae, Pseudomonas aeruginosa. The correct answer is D.